Good morning, David and fellow classmates. Today I'm here to talk to you about dementia and how it affects the family members. I chose the topic because my grandmother passed away from it a couple years ago, and we never knew what type she had. And as a CCA, it was my favorite part of the job, seeing the difference it affected each patient. You might be asking yourself, what is dementia and how can we tell if a loved one has it? Well, that is a very good question. And here is the answer to those questions. Dementia is a term used to describe a bunch of different diseases and conditions affecting memory, language, problem solving, and thinking skills. When all these abilities are affected, the patient loses their ability to do regular everyday activities such as bathing, cooking, feeding themselves. But as a family member, there is some signs that you can look out for, such as problem with short-term memory, forgetting to plan or prepare meals, forgetting to pay their bills, and even changes in mood. I chose to talk to you today about 5 different types of dementia, how they affect the patient that gets diagnosed with it, and how a patient gets diagnosed. The first type I'm going to talk to you about is Alzheimer's disease, which is caused by a shrinkage of the brain. It affects every brain function and can cause significant amount of changes such as patients' behavior and interpersonal relationships. Alzheimer's disease affects 60 to 80% of patients diagnosed with dementia. The only way a patient can be diagnosed with Alzheimer's disease is with a PET scan, which is an image test that focuses on how the brain is working. There are 7 stages that the patient will go through, from no impairment to very severe decline. The second type I'm going to talk to you about is Lewy body dementia, which can also be known as dementia with Lewy bodies. This is the second most commonly known type of progressive dementia after Alzheimer's disease. The cause of Lewy body dementia is protein deposits called Lewy bodies, which develop in the nerve cells in the brain region that control thinking, memory, and motor skills. Lewy body dementia causes progressive decline in mental abilities, which some patients might experience visual hallucinations and change in alertness and attention. Lewy body dementia is very hard to diagnose because it shows the same signs and symptoms as Parkinson's disease. This type of dementia affects males more than females. There are no specific tests that doctors can use to diagnose this dementia. They usually use just their condition and their past history. The third type of dementia I'm going to talk to you about is vascular dementia. And this type of dementia can happen suddenly due to patients suffering a stroke due to blood vessels in the brain being blocked. This type of dementia begins as mild changes, but gradually gets worse as the result of multiple mini strokes, or another condition that affects smaller blood vessels that lead to widespread damages. Only 5 to 10% of cases are diagnosed with this type. Vascular dementia is usually diagnosed after a stroke has occurred because they find it on an MRI scan. The fourth type of dementia I have chosen to talk to you about today is frontal temporal lobe dementia. This type of dementia tends to occur in people younger than would be diagnosed in Alzheimer's disease. This type resembles Alzheimer's disease the most. One of the other types, except that this type affects the frontal and temporal lobe, whereas the Alzheimer's disease affects the whole brain. There's no single test that can diagnose this type of dementia. The last type of dementia I chose to talk to you about today is called mixed dementia, which is just a mixture of characteristics from Alzheimer's disease, vascular dementia, and Lewy body dementia. This is the most common out of the 5 types to go undiagnosed due to its having so many characteristics. Mixed dementia is sometimes not found unless an autopsy is performed. Many people don't know that taking care of an elderly person, relative, or just being a caregiver is hard on the regular basis. There are many feelings that family members and caregivers can have, such as guilt, grief, loss, and anger. If you are a person looking after a loved one with dementia, rest assured you are not alone with these feelings you are having, but there is help out there. All you have to do is ask your family doctor, contact your local continuing care agency, or go onto the Canadian Alzheimer's Society website for more information on how to cope with these feelings. In conclusion, there are many types of dementia and there are many effects on the patient that gets diagnosed. There is not one specific test that can be done to determine the types of dementia they have. There are many feelings that a family member can have, but just remember there are places and people you can talk to that can help you cope with these feelings.